Go?
Yep. Good to go.
Okay, well, good morning. Just going to give you an update this morning on the COVID situation here in the Murrumbidgee Local Health District. And I just want to start by saying to our community that we have no more confirmed cases of COVID-19 across our region, but that is not a reason for us to become complacent. I think in New South Wales, we have a real situation now where we have clusters in Sydney. And the message to all of you in the community is we cannot afford to be complacent. Yes, we have Christmas and we have eased restrictions, which means that people can now move around more freely across our region, but we have to be even more vigilant now that we have the situation in Sydney. So we've made some changes here and I wanted to talk you through those today, which will help to keep our community safe. So the first thing that we have done is within our hospitals, there is even more stringent screening now when people come in to visit their loved ones. So people will continue to have their temperature checked, but with screening, anybody who has been in the Greater Sydney region recently will be excluded from entering our hospital. And we appreciate that may be an inconvenience to people, but it's absolutely really critical that we keep our patients and our staff safe. New South Wales Health Officer has made the decision with residential aged care effective now that we are closing down our facilities and so no visitors will be allowed in over the next 3 days, Monday, Tuesday, Wednesday. That situation will be reconsidered at midnight on Wednesday for Christmas. And look, our heart goes out to families and residents who live in aged care facilities who've done it really tough during this COVID situation over the last 9 months. Elderly population safe. So we'll go back, of course, to the message that anybody who requires special care or who's palliative, but of course we'll make special considerations for those residents, and that's really, really important. So really, really strict visiting restrictions now in our residential aged care facilities. Across our hospitals, we've gone to what we call an amber alert. That means that we're wearing masks again in our hospitals, and that applies to visitors. So the minute you walk in the door, everybody in the hospital will be required to wear a mask and of course socially distance, wash their hands, and the messages that I'm going to go through with people now. So for our clinicians again, that's wearing masks all day, every day, so you'll see that. But the message to the community really is we have become a little bit complacent with no new cases in New South Wales for quite some time. We've got Christmas and New Year and people are just so overjoyed about being able to catch up with each other. And I must admit, I've seen a whole lot more people putting out their hand for a handshake and a few hugs and things going on. Please, to the people in Murrumbidgee region, social distancing is what is going to keep us safe. Please do not hug, kiss, shake hands. We just do need to maintain that social distancing outside, obviously, of your own family environment. The other thing is we're traveling around a lot more, so hand hygiene and carrying hand sanitizer is really, really important. If you're having a Christmas gathering, keep it small, try and be outside as much as you possibly can, and think about things like not sharing utensils, having one person do the serving up of the food. So be really careful because we just want to avoid any sort of contamination. And if you are traveling, absolutely make sure that you are well. So the message is if you're unwell, stay home, get tested, and stay in isolation until you receive your testing results. We will maintain our testing over Christmas and New Year. We've increased the hours both at Albury and in Wagga Wagga. And we've really seen the numbers ramp up over the weekend. We've done 1,300 tests, which roughly double what we were doing previously. That's good news for our community. You've heard the message, so thank you. Even the slightest symptom, please come forward and be tested and then stay home until you get your results. And if you have been in Sydney since the beginning of December, please check the New South Wales website. There's now a list of up to 80 venues that we are monitoring. So if people have been in those venues, the idea is that you get tested and you stay home and you must stay in isolation for 14 days. So whilst we're all looking forward to Christmas coming, the message is we must remain vigilant. We can't be complacent. We have to maintain our social distancing, 1.5 metres. We need to keep washing our hands, carrying your hand sanitizer around with you. If you are going on an aeroplane, please ensure you wear a mask. And if you can't socially distance, if you're on public transport, then again, you should be wearing a mask. So thank you very much for all of your work over the last year. Unfortunately, we have to keep it going, and COVID is still with us. It won't go away until we have completed the mass vaccination program over the next 12 months. So happy to take questions.
I suppose if this does escalate and we start to see more cases here or an outbreak here, are we prepared? And how are we prepared? Talk that through.
Thank you. So we have never moved away from both our response to COVID-19 and also our preparedness. So being prepared means a range of things. It means the most important thing is the public health response. So over the weekend, our public health unit, our virus detectives, they've been helping out with the contact tracing in Sydney. So we've got a really good workforce here that can scale up to be able to do that work early. What will keep us safe and prevent an outbreak is if people get tested early and then we do that contact tracing, and that makes sure that we get people then into isolation so that it doesn't seed and go out across our region. So the public health response is important, testing and contact tracing. But if we did actually get an outbreak here, then being care and treatment for people is important. So we've got a hospital in the home model where we can monitor people in their homes if they're well enough, and we've had some quite sick people that we've been able to monitor at home. And of course, our intensive care capability can be ramped up at any time. We have the ventilators, we have the staff trained, so we are prepared for any sort of circumstance that comes. But look, I'm really confident that New South Wales Health has got a really good process around that early testing, that early contact tracing and getting people into isolation. And in Murrumbidgee, the best thing is we've got compliance. We've got fantastic people who will actually all come together and do the right thing, and that's what will make the biggest difference. Yeah.
It probably will be, hundreds if not thousands of people thinking about heading to Sydney for Christmas, for holidays, going through the airport. Is there anything they can do to, if they are there already or if they have already booked their plans, can they do anything to make themselves safe before they come back?
Well, I think generally speaking, I would be asking people to reconsider travel plans to Sydney, because people who do go to Sydney might find that they will be required to isolate when they come back. If you're travelling through Sydney to another destination, then the messages in the airport are about those hand hygiene, socially distancing, but other things such as always managing your own luggage so that you don't have other people's hands on your luggage, and wearing masks at all times, both in the airport as well as on the plane. But I really ask people to have a good look at all of the government websites across the various states, because it is a changing situation every day, and we've seen the borders close and various restrictions at different states. So people really need to be monitoring if they are travelling out of New South Wales through Sydney. You need to be monitoring the other state websites so that you understand the requirements. For example, you can't go to Western Australia anymore, and you may need to get permits if you're going into Victoria. We do have obviously the situation again with the Victorians now with some border restrictions. So again, people who live in that border community, both on the New South Wales and Victoria sides, have had a lot of really serious issues to put up with in recent months since July. They're thrown back into that situation again now. But I just encourage everybody to make sure you go onto the Victorian website. We're in the green zone in most of the Murrumbidgee region. It just means that you will need to be able to show that you haven't been to any of the cluster areas in Sydney, Northern Beaches, and those areas that are identified on the website, and you always carry your photo ID with you. Yeah.
Will opening hours over Christmas and New Year's be extended for the testing sites, or will they stay the same?
So we are extending the hours of the testing sites, particularly Wagga and Albury. We've already extended the hours out to 5 o'clock in the evening now because the numbers are increasing. So where we have increased demand, we will definitely increase the hours and make sure that we keep that COVID hotline for people to call. If you're feeling unwell, ring our hotline and we can match you to the most appropriate service. Over Christmas and New Year, clearly we've got some of the other clinics, the private clinics and some of the other clinics that are run in the towns not operating in the public holidays, but we will keep ours operational.
Just in terms of the aged care, I know you said you'd reassess on midnight on the Wednesday night. How do people find out if they are allowed to visit their family? What's the best point of call for them to ring or to find out?
Yes, and look, I appreciate people will be really disappointed, and we all hope that we can have families visiting their residents over Christmas period. The Chief Health Officer in New South Wales will make that decision, and that will be based on how the outbreak situation is going in Sydney. For families to find out what's going on, I just ask that you probably ring your local hospital or your residential aged care facility, and the local manager there will be able to update people as we go along. But we'll certainly keep you, the media, involved because a lot of people will hear about it through you as well.
Oh no, you go.
So you got any concerns that people have already here? Jill, obviously lots of people have already come out of Metro Sydney. Is there any advice for them? Are we worried about what might be in the community possibly?
Well, one of the unique features of Murrumbidgee Local Health District is we've got the Hume Highway that literally transverses right down through the middle of our region, and plus lots of people are rediscovering regional New South Wales, so there are a lot of people from Sydney already here. So my message is this: firstly, look on the New South Wales website because there is an extensive list of venues that people need to check if they have been in those regions. But most importantly, even the slightest symptom, then please come forward for testing. And make sure once you've had your test that you stay home and in isolation until you receive your test results. And just reiterating, we are really fortunate. We've got a really great turnaround time in our region, 24 hours, and you'll have your test results. For people who have been in any of those hotspot areas in Sydney, they have to remain in isolation for 14 days.
Those people who are in Greater Sydney and are thinking of coming to the Murrumbidgee but aren't here yet, what would be your message for them? Would you encourage them to rethink their plans too?
So obviously people who are in the Northern Beaches and the Avalon area are in lockdown at the moment, and that will be reconsidered by the Chief Health Officer in the coming days. For people in the Greater Sydney area, Central Coast and Illawarra, Shoalhaven, they have been asked by the Premier to restrict their movements, and we really ask people to reconsider their movements because it is really important that we keep our regions safe. And again, if people have to travel, then they need to make sure that they are well when they leave and that they monitor their symptoms carefully.
What would the MLHD think about, sort of a ring of steel like we saw in Victoria to, protect the regions from those areas which might be at greater risk?
Well, obviously the different state governments make decisions based on the advice of their Chief Medical Officer and their Chief Health Officer. I'm really confident Dr. Kerry Chand, the New South Wales Chief Health Officer, is really a very, very competent and highly respected scientist and doctor, and I will absolutely go by the decisions that she recommends through to government. And I'm confident that she and the team around her are making really good decisions.
I was pretty much going to ask the same thing. People are being asked to do things, should they be told to stay home? It seems a little bit sort of, if you can stay home and if you'd like wear a mask, would you like to see that advice a bit more strongly delivered, I suppose?
There's different thinking about mask wearing, and we know that if the majority of people are wearing masks, we reduce the transmission of communicable diseases. But there is also the body of thought that when you wear a mask, you're more likely to touch your face. And if you don't wear your mask correctly, then it actually doesn't do any good at all. So our Chief Health Officer has made the decision to strongly encourage masks, particularly where you can't socially distance, when you're outside and even inside in high volume areas such as supermarkets and shopping centres. And what we're seeing is people are actually being really compliant. They want to stay well, and so we're seeing really great compliance with wearing masks, and I think we'll just keep reevaluating the situation as it evolves.
Just have a few from the border mail as
Sure.
well. So do you think that, you know, the hard border that's being reintroduced, I know that there's still a permit system and we're in the green zone, do you think that it's the right move to protect communities on the Victorian side of the border?
Well, I understand the decisions that are made by the Victorian government are for the safety of their communities, and I think that the restrictions that they've put in place with the traffic light system, red, amber and green, is reasonable, and I think people who have lived in that border bubble with getting exemptions and all of the disruption to business and connecting with families has been really traumatic for those people. I think that what we're seeing now around people being able to travel freely around the area just with your photo ID makes great sense, and it's going to keep, obviously, people in Melbourne who have been through an extensive lockdown, keep them safe too.
And then just one other matter, are you concerned about staffing in our hospitals in the region over the Christmas period, and which hospitals or multi-purpose services are going to be without a doctor?
So in terms of rural workforce over Christmas and New Year, every year we go through the same scenario, which is particularly in towns where there's only one doctor, small communities, and our medical officers deserve holidays and they deserve that break just as much as everybody else. So every year we have a few of our facilities where the doctor goes on leave. But there's two things I want to say. The first one is, don't forget nurses, highly trained, advanced skill nurses. The emergency departments remain open, and we have employed GPs that work in a virtual care centre, so those nurses can adequately assess patients. Our GPs can also admit locally. So I think from where we were, where when there was no doctor there was nothing, to what we've got now, which is highly trained nurses, and we've got the doctors through the virtual care. They can assess, they can treat. We don't need to transfer people to Wagga or Griffith. They can actually look after them if it's appropriate for them to stay locally. So that virtual GP service we've got is working really well, and many of our doctors are really grateful that they've got that additional support because they can go away and take holidays confidently. For some of the bigger sites, fortunately, we've been able to secure a locum for Tumut, all but one day. What has really changed since COVID is that we are really finding it difficult to get locum doctors. I think those doctors who used to freely travel around Australia doing rural hospital stints, they have stopped doing that, and the locum market has dried up. So in some cases, we've had locums secured for sites such as West Wyalong, and then they pull out at the last minute. It's really, really challenging. We are committed to having doctors at every hospital, and we are working really hard to find locums where we possibly can, and we'll continue to do so. But please respect those highly trained nurses who can now connect virtually with the GPs and care for people in their local environments.
Just on the highly trained nurses, I've also been told that Batlow and Tumbarumba don't currently have 2 registered nurses rostered on. Is that the case, and can you comment on that?
So we always have a turnover of staff, and that happens regularly. I think when you've got small sites such as Batlow and Tumbarumba, registered nurses are really hard to get to go to small communities, particularly where the work is largely aged care. But I have to say, if there are vacancies in rosters, we always look to get agency staff or to use casual staff or to have people who work part-time working up. We have to cover rosters. So that's really important. It becomes draining for people if they are working additional hours when they don't necessarily want to, because we're having difficulties getting agency staff. But look, the rural workforce issues post-COVID have changed. It's much harder for us to now recruit staff, secure staff, and particularly around agency nurses and locum doctors, it's much harder than it usually is. But we are committed to filling rosters, and we always do, but it does, I think, sometimes cause some anxiety for some of those smaller communities. Yeah,
Thank you.
thank you.
Thanks, Jill.
Thanks, Jeff. Thank you.
Okay,